Chattanooga INTELECT, one of the very important things when you make an investment in radial pressure wave is to ensure that you get clinical support and training. One thing that I like about the Chattanooga is that they do offer that clinical support, and they also offer online education. So this is something really nice because you can learn at your own pace. Now, one of the things that you're going to learn about is when we're looking at using radial pressure wave to reduce pain as an analgesic, then it needs to be a noxious stimulus, okay? Shockwave needs to be slightly uncomfortable. And most clinicians around the world now are using a visual analog scale where 0 is no pain and 10 is the most uncomfortable pain. And we suggest that you go no more than a 7 out of 10 on that scale. Now, in response to that noxious stimulus, your body's going to release things like substance P and CGRP, calcitonin gene-related peptides. These are neuroinflammatory markers. And your body's going to respond to that, and responds by increasing localized blood flow. So we get a massive increase of local blood flow. And that has a washout effect. It reduces the irritative nature of those neurovascular substances like histamine, prostaglandin, serotonin, all those irritative substances which cause us pain. And this washout effect has been shown in the literature to last anywhere from, we get almost immediacy within sort of 5 minutes, but it can last up to 4 weeks. Now, this gives us, as therapists, a fantastic window of opportunity. Because if we're dealing with something like a chronic tendinopathy, we again know from the literature that a graduated loading program, an optimal loading program, is good for this type of tissue. But if we have patients who have pain, then obviously that becomes a hindrance an obstruction to our rehabilitation. So having this window of opportunity which Shockwave provides for us really enhances our management. So for me, especially with tendinopathy management, it's a combination of Shockwave and optimal loading which provide the best outcomes. Now, in order to get a noxious stimulus, we need to use quite high bar pressures. And the evidence shows that the more energy we put into the tissue, the quicker we can resolve the problem. But as we know, all patients have different levels of acceptability when it comes to discomfort and pain. So typically, I would like to treat between 4 and 5 bar pressure. Now, for a lot of conditions, this is considered high. And certainly, if I try to start at 4 bar pressure, this would be like me trying to strike someone with a hammer. And quite naturally, the patient's going to pull away and object to it. So one of the key features I like about the Chattanooga radial pressure wave machine is this ramp up feature. Now, if I turn this ramp up feature and I now press start, you will hear the compressor going to create the compressed air within the system. But here within the screen, you'll see that we are starting at 1.4 bar pressure. So we're not going straight to this 4 bar that you could have to try to start with other machines. What's going to happen over the course of these 2,000 shocks is this bar pressure is going to gradually build up. Now, the benefit of this is that the patient can accommodate to the feeling. And as they accommodate, they can better accept the higher bar pressures. And this is how I'm able to treat patients between 4 and 5 bar pressure. Now, of course, not everybody can do this. Patients will have a limit. But so during the treatment, During the gradual increase in bar pressure, it's very important to communicate with your patient. And when they get to a level that they feel is their maximum, this is fine, we pause the machine and then we have the ability to drop down the bar pressure to the level that the patient feels they can accommodate to. Very, very useful feature called the ramp on feature, and it's unique to the Chattanooga RPW INTELECT machine.